Welcome again to my channel, or welcome back to my channel. This is your favorite nurse from Travessence, and today we're going to be continuing the education of the diabetic patient. Now, for those of you who have been with me, we have spoken about the risk factors of being a diabetic. We have spoken about the signs and symptoms of diabetes. We have also spoken about why some of the signs and symptoms are the way they are. Now, today, we're going to take it a little bit further, and we're going to talk about the insulin treatment of the type 1 diabetic patient. Now, those of you who aren't nurses or you are not in the medical field, you may not have had the privilege of reading about how the treatment of diabetes has evolved over the years, but it has been really phenomenal over the years that the treatment of diabetes have come this far. Because before all of this, people were dying and not even realizing that they had diabetes and that's what was causing their death. But thanks to a lot of pioneering physicians who have experimented with animals and the pancreas of animals and has brought us to this point where we can live longer, healthier, and more fulfilling lives even after a diagnosis of diabetes. The treatment of diabetes has evolved over the years with the modification of insulin treatment that have resulted in patients living longer and more fulfilling lives after a diabetes diagnosis. When Frederick Banting and Charles Best isolated insulin from pancreatic cells and administered it to diabetic patients, the lives of millions were saved, and even today, millions of type 1 diabetic patients benefit from this remarkable medical breakthrough. And this happened actually in 1921. Today, we are going to look at some of the different types of insulin that's used to treat type 1 diabetes. There are several different types of insulin that's used to treat diabetes. And insulin is classified as the #1 medicine for diabetic treatment. We are going to look at how it works and how long it works in your body. First, we will look at the 3 terms associated with insulin. Number 1 is the onset. And the onset has to do with how quickly insulin lowers your blood sugar. Number 2, the peak time. And the peak time is when insulin's at its maximum strength in your body. Number 3, the duration. How long insulin works to lower your blood sugar. So now you have the 3 actions of insulin that we are going to look at: the onset, the peak time, and the duration. Your doctor will prescribe the best insulin for you based on several factors: the food you eat, how active you are, your age, how well you are able to manage your sugar levels, and how long it takes your body to absorb insulin and how long it stays active. Now remember that everybody's body is not the same. So the way insulin acts in my body is going to be different from the way insulin acts in your body. So the best person to determine the best type of insulin for you is your doctor. Do not say, well, my mama has diabetes, and so I'm just going to take a little of her insulin. Don't do that. Do not ever use the medication that is not prescribed for you, because a prescription is person specific and ailment specific. You cannot use somebody else's medication, because the action of that medication on that person could be totally different from its action on you. So let us continue. Today, there are several different brands of insulin on the market, with each brand sporting its own onset, peak time, and duration. Let's look at rapid-acting insulin. Rapid-acting insulin may have an onset of about 10 to 15 minutes. It has a peak time between 30 minutes and 1 hour, and it will last in your body for about 2 to 4 hours. That's rapid-acting insulin. Next, we are going to look at regular short-acting insulin. Regular short-acting insulin has an onset of about 30 minutes, and its peak time is about 2 hours. Its duration is about 3 to 6 hours, and it is usually taken 30 to 60 minutes before a meal. Now, that is very important, that you give the patient the insulin before they eat. And you must check the blood sugar before you administer insulin, because you never know. You can't just go ahead and give a patient insulin just because the patient is diabetic. You must check the blood sugar so you know what the numbers are before you cover the patient. If a patient's blood sugar is below 70 and you give insulin, that could cause the patient to do what we call bottom out, which means that the patient's blood sugar could go so low that it's no longer compatible with life. Also, if you are a diabetic, your doctor might give you a sliding scale. And you might ask, what is a sliding scale? So a sliding scale is a chart that you go by based on your blood sugar levels, how much insulin you will get. So your scale might look like 150 to 200. You get 2 units of insulin. 201 to 250, you get 4 units of insulin. 251 to 300, you get 6 units of insulin, and so on. But your doctor will determine your sliding scale based on how insulin acts on your body. Next, we are going to be looking at the intermediate acting insulin. Intermediate acting insulin has an onset of 2 to 4 hours, a peak time of 4 to 12 hours, and a duration of 12 to 18 hours. And for those of you who are nurses, this sounds like Lantus, right? Okay. Yes, Lantus is an intermediate acting insulin that lasts rather long time in the system. These types of insulin covers the patient's insulin need for half a day or overnight. And in some cases, it's used with rapid or short-acting insulin. Long-acting insulin has an onset of 2 hours, but it does not peak. Long-acting insulin has an onset of 2 hours, but it does not peak. That's one thing to remember about long-acting insulin. Its duration is up to 24 hours and it covers the patient's insulin needs for about a full day. So now we have gone over rapid-acting insulin, regular short-acting insulin, intermediate insulin, and long-acting insulin. Now, the long-acting insulin is often used as needed with rapid or short-acting insulin. Ultra-long-acting insulin has an onset of 6 hours and it does not peak either. So ultra-acting and long-acting insulin, I want you to remember those two. Long-acting insulin and ultra-long-acting insulin do not have peak times. But the ultra-long insulin lasts 36 hours or longer. You know, sometimes you have a patient come in and they say, oh, they give themselves insulin every other day. Well, that tells you that that patient is probably using an ultra-long-acting insulin to control their diabetes. And the ultra-long insulin provides a steady insulin release in the body for long periods. Now, let us go over what we have learned so far. So we have learned that type 1 diabetes is usually treated with insulin. We have learned that we do not use anybody else's insulin. We have learned that the doctor might give us a sliding scale to go by to determine how much insulin we take based on our blood sugar levels. Also, we have learned about several different types of insulin and their actions. Rapid-acting insulin, we have learned also of regular short-acting insulin, intermediate-acting insulin, and more than anything else, we have learned that there are 2 types of insulin that does not have a peak, and that is long-acting insulin and ultra-long-acting insulin. They do not have a peak time, but all other insulins have an onset, a peak time, and a duration. Go ahead, check yourself. Check with your doctor if you have any signs and symptoms of diabetes. Have yourselves a healthy day. And don't forget that your journey matters. Until next time, this is Trev from Trevessence. We will come again and talk about some more healthcare topics. If you are suffering from diabetes or any other healthcare problem and you would like for us to talk about it, you would like for us to give some information about it, you are always welcome to email me, text me, call me on WhatsApp, whatever the case may be. I will be more than happy to give you some information from a nurse's perspective. That's going to be it from me for today, my friends. Until next time, this is Trev from Trevessence, where your journey matters. Have a healthy day, guys.